Thousands of years ago in the Yoga Sutras of Panjali, pranayama is mentioned. So it was discovered that how you breathe affects your mental and emotional and physiological health. You can read this on your own, Why Deep Breathing Relaxes Your Brain. It's by Forbes magazine. I'm going to get into it deeper with some of the research in a second here. Why your out-breath is connected to your well-being. If you take a DBT class, now I was aware of this because I was already well-schooled in Qigong, Taoist meditation, Buddhist meditation, and yoga. While other people, I got kicked out of school in 3rd grade, so while other people were studying, bullying and other useless crap, I was studying the roots of esotericism and things of that nature, comparative religions and yada yada yada, and practicing ritual magic. Some would say I wasted my time. I would say no, I learned things that other people didn't. There's nothing in a DBT class that you won't find in a great book on magic, like such as Aleister Crowley's Magic, or a good book on a good self-help book. So DBT is honestly unnecessary. It's self-help while you're paying people to help you, essentially. So towards the end of a yoga class or during the guided meditation, it's likely you've heard of some version of let's take a few slow deep breaths. Okay, you've heard that probably ad nauseum. And you can read this on your own if you'd like. So what is diaphragmatic breathing? Diaphragmatic breathing is the cornerstone of how you breathe in yoga. Okay, you're breathing down, and it's also the cornerstone of how you breathe in Taoist meditation and Buddhist meditation. Now, Buddhist meditation 100% definitely comes from yoga. Okay, Taoism seems to come from the shamanic traditions of ancient China, but it was heavily influenced by Buddhism. But the point is that this comes from similar methods as the Yoga Sutras of Panjali. Something that people might not know is that Kung Fu or Kung Fu actually comes from India in a lot of ways, in the sense that it was the training methods brought by Bodhidharma from India, the meditation and physical exercises that are similar to yoga. If you read the 72 Consummate Arts of the Shaolin Temple, you will find that out, that it was Bodhidharma that brought from India the roots of what we call Gong Fu or Kung Fu, that was blended with ancient Chinese methods of war, or wushu. Okay, how to do it. This is how to do diaphragm. So diaphragmatic breathing is a natural process that usually occurs without conscious effort. However, the average breath tends to be shallow and does not engage the diaphragm very much. During diaphragmatic breathing, a person consciously engages their diaphragm in order to take deeper breaths. A person will notice their stomach rising and falling. They will also feel an expanding or stretching sensation in the stomach rather than solely in their chest. How to do it? There's a lot of ways. Lie down on a flat surface with a pillow under your head. Okay, blah, blah, blah. Okay, place one hand on the middle of the upper chest and place the other hand just below the rib cage. Inhale slowly. Breathe in through the nose, drawing the breath down toward the stomach. The stomach should push upward against the hand. It should say outward. Well, I guess it would be upward if you're on your back. To exhale, tighten the abdominal muscles and let the stomach fall downward while exhaling through pursed lips. Again, the chest should remain still. Now, this is very important. This is how you breathe for the most part in Buddhist meditation. In Taoist meditation, you would be breathing in and out through the nose with the tongue against the roof of the mouth. However, I would recommend the Buddhist meditation, which is exactly like this. People should practice this breathing exercise 5 to 10 minutes at a time, around 3 to 4 times a day. Now, when you get into deep meditation, you'll be doing this much, much longer than that. Okay. Now, the benefits of diaphragmatic breathing are it strengthens the diaphragm, improves stability of the core muscles, slowing the breathing rate, lowering the heart rate and blood pressure. It reduces oxygen demand. It promotes relaxation. What conditions can it help? Well, obviously, we're doing a video on autonomic dysfunction. It can help with autonomic dysfunction. Before I continue, though, I want to make sure that you understand I'm not a doctor, I'm not an MD, I'm not a DO, I'm not an ND, I'm not a chiropractor, I'm not a physician of any kind. I'm not a nurse, I'm not an RN, I'm not an LPN, I'm not a nurse practitioner, I'm not a dietitian, I'm not a nutritionist, I'm not a physical therapist, I'm nothing like that. Don't get medical advice from a YouTube video. If you have a medical issue, contact a licensed practitioner of the healing arts. Now, what conditions can it help? It can help with stress and anxiety. It can help with chronic obstructive pulmonary disease, or COPD. It can help with asthma. Okay. The risks of diaphragmatic breathing it's not always useful as a standalone treatment. People should not rely on diaphragmatic breathing alone to treat conditions such as anxiety, asthma, or COPD. Now, this is why you have to stack diaphragmatic breathing with good diet, with good exercise, with supplementation, visiting a medical practitioner that actually believes you're not crazy. These are all benefits of that sort of thing. Additional treatments, now I wouldn't, okay, so of course, let's move on here. So this is from the National Institute of Health. This is a research paper. It's the effects of diaphragmatic breathing on health. So, introduction, breathing is an essential part of life. We all know this. Exhale, yada, yada, yada. We just went over this. This is going over diaphragmatic breathing. Breathing in slowly and deeply through the nose with a minimum of movement of the chest in a supine position with one hand placed on the chest and the other on the belly. Diaphragmatic breathing has an impact on the brain and cardiovascular, respiratory, and gastrointestinal systems through modulation of the autonomic nervous system. Interesting, you'll notice somebody wearing a dobok there. That's pretty cool, huh? Didn't expect to see that on the National Institute of Health Research. This is a narrative review. This is the different methods, the results. COPD is the most well-studied disease on which diaphragmatic breathing has had a significant effect. Okay. So, involving 1,233 subjects were included with a mean age of 51 to 73 years and a mean forced expiration, blah, 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 blah. Okay. Let's see here. The effect of breathing exercise in children with asthma was systematically reviewed in 2016. Heterogeneity. Dysfunctional breathing is associated with poor asthma control in children. Assess the effect of breathing exercises in children with dysfunctional hyperventilation syndrome. However, no eligible studies were found for this systemic review. Let's get to the results here. Boom. Previous systemic reviews and meta-analyses have shown that diaphragmatic breathing is effective for improving the exercise capacity and respiratory rate in patients with COPD and on the other hand, diaphragmatic breathing could deteriorate dyspnea in severe COPD. This isn't for COPD. This is, of course, for, autonomic dysfunction. Moreover, the effect of diaphragmatic breathing of patients with asthma still needs to be investigated further. Okay, furthermore, diaphragmatic breathing could be a feasible and practical technique for patients with such disorders, although further studies are needed. Further studies are always needed. Don't let that deter you. So, at least the Cleveland Clinic is confident enough to put out a thing on the benefits of diaphragmatic breathing. Okay, what is the diaphragm? The diaphragm is a female prophylactic. No, I'm just joking. The diaphragm is the most efficient muscle for breathing. It's a large dome-shaped muscle located at the base of the lungs. Your abdominal muscles help move the diaphragm and give you more power to empty your lungs. What is diaphragmatic breathing? Okay, diaphragmatic breathing helps you use your diaphragm correctly while breathing to strengthen the diaphragm, increase the work work of breathing by slowing your breathing rate, decreasing oxygen demand, and use of less effort and energy to breathe. During diaphragmatic breathing, you consciously use your diaphragm to take deep breaths when you breathe normally. You don't use your lungs to their full capacity. Diaphragmatic breathing allows you to use your lungs at 100% capacity to increase lung efficiency. What are other names for diaphragmatic breathing? Abdominal breathing, belly breathing. Do certain conditions make it harder for me to use the diaphragm? Conditions like COPD may prevent the diaphragm from working effectively. Your lungs rise and fall naturally, but when you have COPD, air often becomes trapped in the lungs. This pushes down on your diaphragm. This is also common in asthma, that air gets trapped in the lungs. Okay, your neck and chest muscles must then assume an increased share of the work. What are the benefits of diaphragmatic breathing? It helps you relax. It improves muscle function during exercise and preventing strain. It improves muscle function during exercise and preventing strain. Now, what you have to understand, with autonomic dysfunction, you're going to want to improve muscle function during strain of everyday things, okay? It increases how much oxygen is in your blood, making it easier for your body to release gas waste from your lungs. It reduces blood pressure and it reduces heart rate. What conditions does diaphragmatic breathing help to improve? Anxiety, asthma, COPD, and stress. Diaphragmatic breathing can help treat certain conditions, but it shouldn't be the only treatment. What do I do? Diaphragmatic breathing. Okay, this is the lie on your back. We've already been through this. You can read this on your own if you want. Link is in the description. This is more about the diaphragmatic breathing technique. Tighten your stomach muscles when you exhale, yada, yada, yada. Do I need to practice diaphragmatic breathing? Yes. Okay. Practicing diaphragmatic breathing makes it easier. It's not something you're just going to know how to do. You have to do it. Okay. How often should I practice diaphragmatic breathing? 10 minutes, about 4 times a day. A note from Cleveland Clinic: as with learning anything new, the first few times you practice diaphragmatic breathing, it may be difficult. It probably will be, because it is very similar. Well, it is. It's meditation, okay? Meditation is not easy. People think it is, but it's not. And this is only a very physical form of meditation. But you're going to have to concentrate. So take a couple minutes each day to practice this new skill, which offers many benefits to your overall health and can help you relax if you have a condition like COPD, asthma, or anxiety. Talk to your provider about diaphragmatic breathing, yada, yada, yada. So this is about diaphragmatic breathing and weightlifting. I want to make sure people know this. Diaphragmatic breathing helps activate your core muscles while promoting muscle recovery. To practice this method, blah, 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 just goes over how to practice it again. This goes about how to breathe when you're lifting weights. There's a couple different maneuvers. You want to avoid the Valsalvo maneuver because you can pass out. Let's just put it that way. That's when you hold your breath. You don't want to do that one. As I said, the ancient yogis were the first that we know of to understand that the breath correlates, the first that we know of. It doesn't mean they were the first, but it's the first that wrote down that breathing is important to the way that you perform. So this article is from Runtastic, and it's going to go over the benefits of proper breathing when running, how to breathe properly while running, nasal breathing versus mouth breathing, belly breathing versus chest breathing, and rhythmic breathing, and also trusting your body. I would highly recommend people read this article. I'm not going to go over it too much, but it goes over the same things that we've already gone over for the most part, although it adds the concept of rhythmic breathing. Maybe I'll go over rhythmic breathing. Okay. So this is how to breathe with your belly. So rhythmic breathing involves matching steps to breath. Okay, this is when you're running or walking. It's a mindful running skill and a running breathing technique. The clinical name for rhythmic breathing is locomotor respiratory coupling. Okay, It's proven energetically advantageous. Okay, this is like when you're running and you're there. Okay, this helps. One, if you do karate or things like that, it helps with technique. It helps with everything, really, when you're practicing any type of athletics. So there are many kinds of running and breathing rhythms, blah, blah, blah. For lower intensity, try breathing in for 3 steps and out for 3 steps. You should only use 2-2 breath when sprinting, blah, blah, blah. Trust your body. Okay. If you do martial arts, you're going to understand this locomotor coupling, but more so in martial arts, what we use it for is punching and kicking, not so much running, because you're not really doing a lot of running in martial arts unless you're running for conditioning. I mean, if you're running in martial arts, that's not martial arts, that's called running away. But let's move on. This is another excellent article on how to breathe to run. This is from Running Shoes Guru. How to breathe and run. There's a belly breathing technique to master. Okay, you can go over this on your own. Diaphragmatic breathing in gastrointestinal patients. Diaphragmatic breathing, also called deep breathing or belly breathing, is a simple technique. How does it help? It lowers heart rate and blood pressure, decreases muscle tension, increases blood oxygenation, brings warmth to the hands and feet, increases energy and motivation, improves concentration, strengthens the immune system, reduces stress hormones, activates the body's relaxation response, can be easily implemented. Now, what I want people to understand is everybody goes over these kooky techniques of pranayama, okay? You don't need all these crazy techniques, okay? There's an excellent book called Therapeutic Breathing. I did a review of it. It was written by I believe he was Taiwanese, might have been Hong Kongese author. It goes over the different Qigong breathing methods. Diaphragmatic breathing is one of the primary techniques, okay? So what's it help with? It can help with diarrhea and urgency, constipation. These are just some of the gastrointestinal symptoms. If you have autonomic dysfunction, sometimes it affects the gastrointestinal system. Learning to practice. Again, this goes over how to practice it. This is telling you to repeat 5 or 15 minutes. Contact the GI Behavioral Health Program, yada, yada, yada. Moving on. So, breath of life, the respiratory vagal stimulation model of contemplative activity. You can read this on your own, but this is a meditative practice, meditative yoga practice, introduction. I'm just going to skip to the conclusion here. You know what? I'm going to skip to this real quick. Stress reduction and anti-inflammation. Okay. So it helps produce phasic change in the parasympathetic nervous system. Furthermore, vagal dominance also leads to better immune functioning, cognitive performance. It increases in vagal dominance in both resting state. Helps with with cognitive performance. Okay. So, evidence and possible mechanisms. The evidence is there for evidence is there for respiration as a mode of okay. So by adopting physiological body patterns associated with relaxation and low threat situations, slow breathing, vagal adherence, project this state, blah blah blah. This is how the yogis, ancient yogis, you can read it in the Yoga Sutra of Panjali. Okay, this is how they discovered it. You can read it in Tibetan yoga. You can read it in all sorts of different types of yoga. This is how they discovered it. Most experimental studies show higher heart rate variability following breathing instructions. Okay, heart rate variability, measure peak, yada, yada, yada. As we do. Possible mechanisms. The first possible physiological mechanisms for these respiratory patterns to stimulate vagal nerve stimulation is biofeedback. Is the way of baroreceptor. This reflex is responsible for regulating blood pressure and is triggered by stretch-activated mechanoreceptors in blood vessels, which leads to activation of vagal branch of the heart node that reduces heart rate and subsequently blood pressure. Now, what should be interesting is the first physician that I'm aware of to implement this, besides Dr. John Harvey Kellogg, but the first physician that I think regular people would respect. I respect John Harvey Kellogg. He's an amazing naturopathic physician. A lot of people don't respect him. But the first one was a guy, a cardiologist, that wrote a book called The Relaxation Response that did research on transcendental meditation, which is essentially this, and blood pressure and heart rate, and realized that he could teach his cardiac patients how to control things like tachycardia, high blood pressure, etc., through deep breathing techniques. So the threshold for triggering this reflex is cardiovagal baroreflex sensitivity. It can be lowered by respiration rate. The second possible feedback mechanism is even more direct and comes from the lungs themselves, the pulmonary mechanoreceptors. Okay. Relaxation versus stress. Health and mental health outcomes. Although the sympathetic nervous system and parasympathetic nervous system can be simultaneously active, blah, 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 blah. The role of chronic stressors on the development of cardiovascular disease through the cardiovascular response of the sympathetic nervous system causing atherosclerosis and hypertension is well documented. In the mental health domain, mood disorders such as depression are widely recognized as being stress-related. Healthy autonomic balance is vagally dominated. So keep that in mind. Healthy autonomic balance is vagally dominated. So a lot of this hippy-dippy nonsense when you go to the therapist, you can do it. A good yoga class might do the same. Regulated emotion and enhanced cognition. Okay, the link between the vagal nerve, blah, blah, blah. Okay, so in the prefrontal cortex is a critical element. Okay, heart rate variability, cognitive control in prefrontal cortex, especially in emotional control. So it helps with emotional control, heart rate variability, okay, and inhibition of intention and emotional stimuli. Okay, changes and okay. Default mode and executive network plasticity, so it helps the brain to change positively. This article states that they have shown that COMT-ACT practices, though diverse, have a number of components in common that can explain their efficacy in individual physical health, mental health, and cognition. Blah, blah, blah. Again, I would strongly advise people to read this on their own. If I read the whole thing, it would be 26 hours long. So I'm going to move on here. The utilization of enhancing rehabilitation by vagal nerve stimulation, as mentioned with the deep breathing exercises, helps with a lot of different things. Okay, so I want to make people aware of that. You can read this on your own. I don't feel like going over the whole thing now. I might go over it in my next video or a later video on this topic. That's all for this video right now. I will be making another video on autonomic dysfunction in a little bit to add to my series on a possible orthomolecular approach to autonomic dysfunction.